Hey everyone, I'm Dr. Lindsay Tuba.
And I'm Dr. JJ Wicker. Today we're going to be talking about play audiometry, but before we dig into that topic, remember to please like and subscribe our information here. Wait, subscribe. Like and subscribe. Can you tell that we're new at this, Lindsay?
But we're so professional.
We are so professional. Like and subscribe to our page and click on the notification bell so that you can get more information as it comes out from our clinic.
So I am so excited about today's topic. It's kind of a part 2 from our previous video where we talked about VRA testing for kids who aren't really ready for what we call play audiometry or conditioned play audiometry. So this is the next step for kids who are just a little bit more capable of being interactive, and this is by far my favorite way to test a child. It's so much fun to do, and parents are even surprised. Sometimes they'll think, I don't think my little one's gonna do that, right. But then you get them in the sound booth and you're playing these fun games, and they really are. It's surprising how you can get a child to light up in different ways. So we're going to talk a little bit about that today.
Yeah. So what we'll do is we're going to do a little demo because this is the kind of thing that we can do for these videos. So when we call it play because exactly like it insinuates, we're playing a game with the kiddo. We're trying to make it interactive, and we instruct them when you hear a bird or any sort of fun little sound, let us know by playing this game. Yeah. And so this is an example that we have.
So this is just one example, but any good pediatric hearing clinic is going to have a billion different types of toys to appeal, not only to appeal to just about everyone, but also sometimes you have to switch toys in between to make it novel and fun. Yeah. So I've just one of my favorite ones is bananas, feeding bananas to a monkey. Like, that's a pretty fun one. But also, if your child has a very specific thing that they love to play with, let us know, or let your pediatric audiologist know, or bring it from home, and we can implement that into the testing, which is extremely effective. So, JJ, do you want to play the kid or the audiologist?
I'll be the kid.
Okay, so I'm going to say, JJ, we're going to play a game. We're going to listen to little birdie sounds. Every time you hear a sound like this, wah, 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 you get to feed the monkey. Yes. So then I will have JJ wear headphones. A lot of times, if I'm in the room with the child testing, I'll put headphones on too, so that I'll say, okay, now we're going to put headphones on. Mom or dad, they're not going to be able to hear it, so just me and you can hear it. Yeah, that's our little secret. So I'll give the toy to the child, and I'll say, okay, put that up to your ear, listen really closely, and whenever you hear that birdie sound, you're gonna feed the monkey. So we'll do a practice round, and I will actually vocalize, okay, let's listen, JJ. Wah, 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 wah. We heard it! And so we get to feed the monkey. Okay, let's try again. Let's see if you can hear it first this time before I can hear it. Wah, 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 wah. Oh, good job! You heard the sound! And then we'll go on to having the child try to do it by themselves. So, okay, listen really closely. Wah, 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 wah. Good job, JJ! That was amazing!
And obviously, the kiddos are going to be way cuter than me doing it. But I think the idea here is that's how we're able to get them to engage. We make a game out of it. We don't call them beeps. We call them birdies, that kind of thing. But sometimes there are cases where kiddos are difficult to condition to this task. And we have ways of working with that, okay? And some of the reasons why they might be difficult to condition to the task is maybe they are shy, it's this fear element, but sometimes there are kiddos who are just on that awkward borderline of being a little bit too old for the VRA that we talked about in the last one, and maybe just slightly too young for play. So when that happens, we can do all sorts of things like coaching and hand over hand. And so what that can look like, I'm going to have Lindsay be the patient this time. And if you're a parent, this is for you, just because a lot of times, especially in my practice, I use the parents a lot for this to help kind of keep things going. So sometimes kiddos might misunderstand the instructions, and so it can help to do what we call hand over hand, which is where I help hold it up to the ear, and I hold mine up to mine as well, and we listen. Beep, 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 beep. Did you hear that? There you go, okay, so now we're going to put it inside there. How awkward do you feel, Lindsay? Just a little bit. So, but that's what hand over hand looks like. So where essentially we're just helping guide the kid to know how to respond. And here again, this is where it's important to be able to look and analyze body language.
Yeah,
I think in the
for
kids,
sure.
because again, you see a lot of the, like the facial expressions light up when they hear that sound, and that can be your cue to know, okay, I know that they heard the sound, so now let's reinforce that.
Another trick I learned from Dr. Kayla Sivas, who's another fantastic pediatric audiologist. She taught, or she used this a lot, and I found it super effective. Is sometimes I will say to a kid, okay, let's close your eyes, because if you're closing your eyes, you can hear a little bit better. And I kind of just stretched the truth a little bit there. But what's so fun about that technique is maybe they have a toy, but what I'm really looking for is for them to show that they heard a sound. And so they'll hold the toy and I'll say, okay, close your eyes really, really tight, and they will. And the second I present the sound, they go like this. So that's a response to sound. I'll say, you heard that? Good job. Now you can feed it, and it's kind of training. So this is something that you can do from home. Grab some cars or a bucket full of little foam balls if you've got those at home, and practice with them. Say, okay, I'm gonna make a sound, and when you hear that, throw that ball against the wall or zoom the car across the table.
Right.
And play with them in that way so that they get familiar and it's more of a fun game. Then when they come to clinic, we have all different kinds of toys.
Yeah.
We can use your toys that you did at home, but the child is more familiar with what's going to happen. It'll be a little less scary. They won't be as hesitant. They'll know what's going on, because let's face it, really the hardest part about any type of pediatric testing is the child just not really being sure what's going to happen.
Right.
Not sure if it's going to hurt. They're in kind of a funny place. So just like with adults as well, but especially with kids, they want to know that they're safe and that this is going to be a fun experience, which we always try to make it.
Yeah, and I think that's where being child-directed is really important, where, again, you let them be the ones to choose the game. So go to a pediatric audiologist who will give them the options. Because some kids, like this might be great for one kid, the monkey feeding the monkey, but the other kid might just totally resonate with like you said, the cars or the magnets, building something with blocks. There's all sorts of options that you can use, so don't limit it to just
and I think this also plays into why going to a pediatric audiologist for your child can be very beneficial if you have access to one compared to an adult audiologist. Now, adult audiologists, there are some that are fantastic at testing children, but they may not have a million toys like a pediatric clinic does. And that can make all the difference in some children. Right. So be sure that you're going to someone who either has a vast array of toys and experience, or if you're going to someone who has a lot of experience and is very comfortable testing, that maybe you bring some extra toys, because if all that person has is blocks, which I've seen many, many times, wooden blocks, well, that gets boring really fast. Yes. And it's very common for me, even with my easier to test children, to be like, I can tell that they're getting bored. They're not responding as consistently. Right. And if I say, do you know what, how about we get a different toy? Their eyes light up and it's like starting over. And so, that's one of the benefits of going to a pediatric clinic or somebody who specializes in pediatric versus adult. You may get an adult that's great at testing children, or you may get an adult that's really crappy at testing children. Right. And sometimes you don't know.
Well, and one thing that I feel like pediatric audiologists are a little bit more attuned to, just because of their experience working, is understanding when a kid is a good candidate for this kind of testing. Because they might be a 5-year-old child who would otherwise be good at doing this play audiometry, but maybe they do have other disabilities or other cognitive things in play, like having like Down syndrome. That comes up a lot, where a child is 5 but has Down syndrome and they aren't quite ready to follow the instructions for a play, and so that's where you back down to the lower ones.
Yeah, and it's perfectly fine and normal for an audiologist to we're in the very beginning, when we're just in the room talking, for an audiologist to think, okay, I think your child's a good candidate for this type of testing. We're going to practice here in the room. We're going to go in the sound booth. We're going to practice. But then having to switch gears depending on your child. That doesn't mean there's anything wrong with your child. Everybody responds differently. And if you've got a good audiologist, they're going to know, okay, time to switch gears. We're going to try this now. And really, the whole goal for an audiologist is to get as much information about your child's hearing in that appointment time. It's not uncommon to need more than one appointment, but we definitely try to get as much information as possible in any way possible in that one session. So, and we love it. I mean, you can usually tell somebody who works with pediatrics loves to work with pediatrics. we have a lot of tricks up our sleeves.
We do.
Yeah,
We do.
and it's so much fun.
It is.
I love it. So that's it for today's video. Don't forget to like and to subscribe and to hit that notification bell so that you can get notified when a new video posts. And also our website will be listed below so that if you want to learn more about our specific clinic, you certainly can. Please reach out to us if you have any questions. Please post comments, questions that you have, video ideas, so that we can be sure that we can get you all the information. And stay tuned. We have a lot of topics that we're planning on discussing. Some a little controversial, even within the audiology world. So we're very excited.
It's gonna be fun.
Yep, it's going to be fun. So we will see you soon.
See you next time.
Bye.